like on echo. So from parasternal long axis, if you see a defect right in this location, right beneath the aortic valve, this is going to be an outlet defect in the majority of patients. You got to be careful. If you tip a little bit, you can get into the membranous portion, but if you're in this true plane here, this is going to be an outlet defect. If you get down here further away from the valves, this is going to be a trabecular or muscular defect. Short axis view, this is where you differentiate your membranous from your outlet. So just beneath the aortic valve. Here, if you look at this like a clock face from about 9 o'clock to noon, these will be membranous defects. Remember, they're right here by the tricuspid valve and right below the aortic valve. So this is what this looks like with color. From 12 o'clock to 3 o'clock, these defects are outlet defects. Remember, they're below the aortic valve and the pulmonary valve. So this is what it looks like over here. As you scan further down the ventricle, if you're here near the mitral and tricuspid valve, this will be an inlet defect. As you scan further down, this will be a trabecular or a muscular defect. In your four-chamber view, we're at the inlet of the heart here near the AV valve, so this defect is going to be an inlet VSD. So this is a patient with a complete AV canal. We already learned about the primum ASD. Here's the inlet VSD. If you had a defect down here, it would be muscular. And then from this long axis, or the so-called five-chamber view, this defect right in here, remember near the aortic and tricuspid valves, is going to be a membranous defect. So here's your membranous defect right here. So membranous defects, most common type that you're going to see in adults, vast majority of VSDs that you're going to see. We've talked about their location. Sometimes you'll see this tricuspid leaflet becomes aneurysmal, closes off the defect, so you really may not have much of a defect left because the tricuspid valve will close that defect off. Sometimes the aortic valve will prolapse and you'll get aortic valve regurgitation. And this defect is best seen in this short axis view and then in that five-chamber view. The outlet VSDs, so we've already talked about where they're located, beneath the aortic valve and pulmonary valve. So this is the defect that most commonly is associated with aortic valve regurgitation. This aortic valve will prolapse to try to close that defect and